Hi guys, and welcome back to my channel. If you are new here, my name is Kita and I'm going to be your favorite respiratory therapy student. And if you have not already, make sure that you subscribe and you hit the notification bell so you never miss another video. And I'm going to hydrate while you do that. Let's get started. Again, my name is Kita and I'm going to share with you how I work at a level 1 trauma center. Now, the actual hospital that I work for in my state was ranked top 4th by the U.S. News and World Report. Now, the hospital, it specializes in bariatric surgery as well as cardiovascular thoracic surgery, and it's a teaching hospital, just to name a few. So let's dig a little deeper into this cardiovascular thoracic. We're going to dive into some medical terminology because a lot of people don't understand medical terminology and they have no clue how to dissect a word. So if you are a visual learner, I will put the actual words on the screen because I am a visual learner and I got you. Just work with me. Work with me. Now, again, let's break it down. For medical terminology, we have prefixes, which come at the beginning of the word, and we have suffixes that come at the end of the word. Now, we have some word roots, and we have some combining vowels, and we have some combining forms. So, let's break it down. Cardiovascular. So, at the beginning of the word is the prefix and the combining form of cardio. Cardio means heart. Okay? Cardio means heart. Now, vascular. So, vasculo would be how you differentiate between those. Let's see. Vasculo means blood vessel. And I'm going to put all this on the screen too because I just got confused for a minute. But it's okay. I got it back right. Vasculo means blood vessel, and AR, which is R in quotations, is pertaining to. So cardio means heart, vascular means blood vessel, and AR, which is pertaining to. So that's what that is. So moving right along to thoracic. Now, thoracic can be done 2 ways. It can be done as thoracic or thoracic cavity. Now, thoracic is the chest. Now, the chest contains the heart and the lungs. And you have your sternum, your ribs, as well as your vertebrae. So, again, cardiovascular thoracic. I work on the heart and lung unit. I told you I got you. Yeah, I told you. So, working as a CNA on a progressive care unit for the cardiovascular thoracic unit, it can get pretty hectic at times because in any given moment, we could have a patient fly in on a helicopter and they go to surgery just like that. So, it can be hectic because we get new admissions at night and there is a lot of things that go on during the admissions process for new patients that come to our floor. After all of that has been done, we actually go get essential necessities for a patient. So, like if it's a man, we get them a urinal, and if it is a woman, we put a top hat in the bathroom. So we go get all of that. The patient has to be weighed and vital signs have to be performed on the spot as soon as the actual patient hits our floor. So, another disclaimer. Now, what I do as a CNA at my facility may be totally different from what you do. And don't go back to work and be like, Kita said that they do this, and this at their level 1 facility. No, ma'am. No ham. Just turkey. Thank you. But anyway, like I said, what we do may not be what you do, and don't get upset or be mad, or I'm not bragging or anything, but this is just what I do when I go to work. But like I said, on a new admission, we have to do vital signs on the spot, as well as get the actual patient's weight. So the actual physician or attending physician, doctor, or whoever is actually taking this patient will have their weight, so they can be able to calculate their medications that they will be receiving during their stay. We do vital signs, we do EKGs, we do blood sugars, we do weights, we do vital signs. We take patients to the bathroom, get them changed, bathe them. If a patient is actually on a heparin drip, they do not actually get in the shower. So, tip. We ambulate patients, and we do, did I say EKGs already? I don't know. Anyway, we do a lot of stuff. Now, it depends on the actual volume that we have, because like I said earlier, if a patient comes in helicopter ride, then they'll have their procedure done, and then they'll go to ICU. And if they have progressed to enough to actually come up to PCU, then they'll come directly to our unit. Now, we normally run with anywhere from 1 to 3 CNAs at night for a 28-bed unit. Now, we do have nurses that actually work alongside us as well. It just depends on the ratio, because if we have 20 patients, we can have anywhere from 6 RN nurses and 3 CNAs or NAs. Now, depending on the specifications for your facility, you may not be required to have a certificate or a professional license to practice in your state as a nursing assistant. Now, myself, I do have credentials, well, a professional license to practice in the state that I live in as a certified nursing assistant. But just check with your actual facility and see if you are required to have a professional license, because a lot of facilities may not require that, and they may teach you on the job. So just be mindful of that. I got you. Just be mindful. It's better to ask than not know, because I didn't know, but I actually had a license, so I didn't have to worry about that at all anyway. Now, back to the video. At our facility, EKGs cannot be done without authorization. Let's put it like that. The physician has to create an order before it can be performed, and we do 12 lead EKGs. And it can be, say like if a patient have chest pain or whatever, an EKG will be done, because the monitor tech that actually sits at the monitor will see the actual heart rate and the actual rhythm waveform of the patient's rhythm, well, their heart rate and everything. So if that is questionable, a doctor will request an EKG performed on admission for the patient. Just depends on the circumstances, just depends on what is going on with the patient, everything. Now, we do strict INOs, which is intake and outputs, because if a patient has an intake of 600 and their only output was like 200, is something going on. So